making regenerative medical treatment a reality, another step forward from PRP therapy. HCBCCM human cord blood cell conditioned media biocell shot 65. Regenerative medicine has been a hot topic in recent years, and the time has finally arrived where the technology can be utilized in not only in beauty clinics, but also in aesthetic salons. In the field of regenerative medicine, Professor Yamanaka's research on iPS cells and stem cells is in the spotlight. It has been reported that these stem cells contribute in generating new cells. In aesthetic medicine, treatments such as PRP therapy and dermapen are popular and are attracting attention. Subsequently, a treatment that utilizes regenerative medicine was born as a beauty method that anyone can use without needles, skin damage, and without downtime. It has received a lot of attention in the beauty salon and aesthetic medicine industries, and has been featured in many trade papers and medical magazines. The research paper Clinical Evaluation of Biocell Shot 65 Using Electroporation was published and presented in the following journals and conferences. March 2021 in the Journal of Cosmetics, Dermatological Sciences, and Applications. July 2021 Cosmetic Science Research and Development Magazine Fragrance Journal Wrinkle Research and Development of Anti-Wrinkle Materials. International Webinar on Otorhinolaryngology, November 2021. The 40th Annual Meeting of the Japanese Society of Aesthetic Dermatology held in Japan in August 2022. International Conference on Dermatology and Cosmetology held in Dubai in May 2023. The conclusion of the paper is that, when the stem cell culture supernatant liquid biocell shot 65 foot was introduced to the skin using electroporation method BB Pinocchio DM5 Super DX Plus, and not simply applied to the skin, and observed the progress for approximately 3 months, and evaluated using a face diagnostic machine, it was suggested that it is effective in improving age spots, wrinkles and darkening of pores, with medical significance. By using the same products and techniques used in the clinical practice described in the paper, salons can perform similar treatments, which will lead to peace of mind and trust not only for the practitioner but also for the customer. The functions of stem cells, which produce cells, include differentiation, that changes depending on the needs of various cells, and self-renewal, which leads to new cells. It is said that aging, the environment, stress, etc. are all causes of the decline in stem cell function. Everyone has stem cells, but as a matter of fact, they decrease with age. When new cells are not produced and skin tissue is not regenerated, cell aging causes various skin problems such as age spots, wrinkles, and sagging. The number of stem cells peaks when you are a baby, and the rate of decrease in stem cells is 1/100,000 in your teens, and the number continues to decrease as you get older. By regenerating skin cells, you will be freed from skin troubles and concerns, and regaining baby soft skin will be a reality with this treatment. The materials used in BioCell Shot 65 are developed in the United States by incorporating a high concentration, 65% of bioactive materials, creating the ultimate anti-aging therapy. Since it is a human-derived raw material, safety and quality control are important. Manufactured under the facility environment of CGMP standards, we have cleared the US FDA guidelines, which are considered to be the strictest in the world. The safety and quality control of raw materials is thorough. Tissues from donors whose safety has been confirmed are collected through sterility testing in accordance with NAMSA regulations, HIV testing of the donor, various blood tests, and psychological testing of the donors themselves. It is harvested from donor tissue and manufactured into products for each part, but the raw material used this time is derived from umbilical cord blood. The umbilical cord is the cord that connects the mother and baby, and the blood contained within it is the umbilical cord blood. This umbilical cord blood contains large amounts of growth factors that your baby needs for growth. The supernatant liquid used when culturing the stem cells extracted from the umbilical cord blood is the umbilical cord blood cell conditioned culture medium. It contains a well-balanced amount of about 300 types of growth factors such as growth factors, cytokines, interleukins, SOD, and exosomes, a current hot topic. During the manufacturing process, tissues and cord blood are collected while ensuring safety and security, and the products are promptly delivered under sterile conditions. It is handled under the same management system as organ donations in Japan. It is safely delivered to a CGMP-compliant facility and processed using aseptic techniques by experts. Accurate cell counts are performed in every step to ensure high quality. Many cases of cord blood cell therapy have been reported. Before and after cases. Lift up and beautiful skin. Acne skin. Improvement of wrinkles and sagging. Hair growth, eyelashes, acne scars. Various wonderful cases have been reported. Our company emphasizes safety, security, and quality results, and develops products based on the theme of fusion of beauty and medicine, and conducts everything from research and development to clinical trials at affiliated medical institutions. We conducted joint research and development with Ryosuke Suzuki, MD, a skin regenerative medicine researcher at PureCode Medical Advisor Company, Ltd. He is affiliated with the Japanese Oral Care Society, the Japanese Society for Regenerative Medicine, the Japanese Umbilical Cord Placenta Society, and the Japanese Society for Cosmetic Dermatology, and specializes in Japan's cutting-edge skin regenerative medicine, including skin regenerative medicine, dermatology, medicine, and tissue engineering. He is a medical doctor who is well-versed in research and electroporation, and is working hard in research and development every day. Our consultant doctors, Dr. Haru Suzuki, Director of Suzuki Plastic Surgery Pediatrics Clinic, and Dr. Maki Yakagawa, Director of Yakagawa Dermatology Clinic, have established a doctor support system that can respond to any skin problems or concerns you may have. At Suzuki Plastic Surgery and Pediatrics, they have completely abolished PRP therapy and are switching to biocell shot treatment due to the advent of baby-derived treatments that have not undergone aging and is painless. From the perspective of a plastic surgeon who has performed numerous surgeries and laser treatments, and who has devised and developed medical aesthetics, consultant physician, Suzuki Plastic Surgery Pediatrics Director, Dr. Haru Suzuki. From the experiences of clinical dermatology and research, ranging from common everyday skin diseases to those that are difficult to treat, we receive not only verification and effectiveness from Dr. Maki Yakagawa, Director of Yakagawa Dermatology Clinic, but also advice on the best way to use the product depending on the intended use. We also continually verify not only effectiveness but also safety. These cases are available for salons to use as counseling tools. As a collection of clinical data from Suzuki Plastic Surgery and Pediatrics Department. BioCell shot 65 for 20 subjects. BioCell shot under 35 for 17 subjects. Clinical data on hair growth. BioCell shot 65 for 12 subjects. We are currently conducting clinical trials and will add new items every year. We have started a new medical affiliated salon system. As an affiliated medical institution, Suzuki Plastic Surgery and Pediatrics supports the provision of safer and more secure services. At regular seminars and study sessions, you can learn not only the latest medical information, but also knowledge and techniques based on medical evidence. You can also share numerous clinical results, trial data, evidence, etc. Dr. Haru Suzuki has commented. The newly established PureCode Medical Affiliated Salon System provides basic knowledge of equipment and formulations and the acquisition of treatment techniques at seminars and other venues, and provides information on clinical results and examples of problems. Sharing this information makes it possible to provide safe and secure services, and we agree that this is a new initiative that will lead the beauty industry as a whole in a healthier direction, so we agreed to supervise it as a medical partner organization. We hope with the establishment of this system, the knowledge and skills of managers and practitioners will improve, and the number of beauty salons that safely perform highly effective surgical procedures will increase, thereby establishing trust in the aesthetic medicine and beauty industry as a whole. Medical Affiliated Salon System feedback from affiliated salons. Since we are in charge of the skin of our valued customers, we felt that safety and security were of the utmost importance. You can be rest assured that not only the treatment but also the materials and products used are supervised by a doctor. In addition, we regularly hold seminars where you can receive direct guidance from doctors and study sessions where you can listen to their discussions, and we also provide detailed follow-up. By forming a medical partnership, I can now serve customers with confidence. Because we have all the evidence, the level of customer satisfaction is different. I'm really glad we formed a medical partnership. This system was interviewed and published in the magazine Nouvelle Aesthetique in a 24-page special feature titled Aesthetics and Medical Care, thinking about the future of aesthetic salons. The cord blood cell culture medium is the supernatant liquid when cord blood-derived stem cells are extracted and cultured. In cosmetics, the stem cells themselves are not used. Stem cell culture fluid contains a well-balanced variety of components that have excellent physiologically active effects, such as growth factors, cytokines, interleukins, SOD, and exosomes, a recent hot topic. It is a highly functional ingredient that prevents skin aging and scarring and promotes skin tissue production. They promote the regeneration of collagen, elastin, and hyaluronic acid, which are the main components of skin tissue. The difference between culture solution extract and culture solution is products labeled as culture solution extract shows the percentage of culture solution within the solution, while products labeled as culture solution shows the percentage of the volume of the solution to the container. So even if the blend ratio is the same, the volume would be different. The total volume of BioCell Shot 65 is 1 milliliter, and 1 milliliter contains a high concentration of 65% umbilical cord acclimation culture fluid. The blending amount and content differ depending on which of the ingredients is listed. Regarding the amount percent notation, ppm. What percentage of ppm does it contain? For example, if it is 400,000 ppm, it will be a 40% blend. For BioCell Shot 65, it is 650,000 ppm. When a 100% freeze-dry is made into a serum, what percentage concentration would it be? Most of them are a two-part type, consisting of a powder and a dissolving agent, and although the powder itself is 100%, the dissolving agent does not contain the cell culture medium, and when mixed, the concentration may be around 10%. Of the total volume of 1 milliliter of BioCell Shot 65, 0.65 milliliters is the cord blood cell conditioned culture medium. What is the difference between exosomes and stem cell culture medium, which are often talked about? Stem cell culture medium is the supernatant of the culture medium in which stem cells are cultured. And the stem cell culture supernatant contains many growth factors that activate cells, including exosomes. Exosomes are extracted from stem cell culture fluid, and they have a small capsule-like shape that acts as a liaison between cells. Its main functions are acting as a liaison between cells, conveying information on both good and bad for immune cells and cancer cells, playing a role in various diseases including cancer and aging. Ryusuke Suzuki, MD, a skin regenerative medicine researcher, explained that stem cell culture fluid and exosomes are completely different from each other, and exosomes are vesicles containing genes. Stem cell culture solutions such as BioCell Shot 65 are cocktails containing exosomes and various growth factors. When simply applied over the skin, there is a risk of degradation by enzymes and oxidation, so I personally believe that BioCell Shot, which contains many ingredients, is better. Exosomes may have good penetration due to their structure, but it seems that there is still a lack of data on cascade reactions in isolation. The expected effects of exosome infusion in medical care are cell rejuvenation and stimulation of stem cell function. Specifically, exosomes are said to be effective in solving skin problems, improving skin quality, hair care, improving immunity, recovering from fatigue, and also preventing cerebral infarction, stomatitis, lifestyle-related diseases, and treating ED. However, there are concerns about side effects with 4 drips. Side effects include nausea, headache, dizziness, and subcutaneous bleeding, and other concerns on major effects such as allergic reactions, infections, thrombosis. All side effects do not necessarily occur to everyone. Regarding exosome therapy, the Japanese Society for Regenerative Medicine has made recommendations to clinics that claim rejuvenation and beauty effects, stating that there is no proven case in humans of treating anything with the administration of exosomes, and there is a risk to the body. We must pay close attention to future trends. Stem cell culture fluids come from human, animal, and plant sources. Among these, we will compare commercially available human-derived and plant-derived products. Human-derived products contain many components necessary for human growth, such as EGF and VEGF. Plant-derived proteins contain ingredients necessary for plant growth, and because they have a different shape from human proteins, many substances are ineffective, so human-derived proteins are often used in the medical industry. As for who owns the umbilical cord and cord blood, it can be said that they belong to the baby and are derived from the baby. Because they are derived from babies, they are the youngest stem cells and are cultured from abundant stem cells. Whereas for other tissue-derived stem cells, the donor is an adult, so they are cultured from stem cells that are aging and have a limited number of stem cells themselves. The balance and content of growth factors cannot match that of cord blood, which has a high potential. The cord blood cell condition culture medium used in BioCell Shot 65 is rich in about 300 types of growth factors, including cytokines, growth factors, interleukins, SOD, and the current hot topic, exosomes. Among them, there are 29 representative types included in the number. It has been evaluated externally by a testing and research institute, not by raw material manufacturer, so it can be said that the numbers are highly reliable. Among various growth factors, cord blood cell condition culture medium contains the growth factor TGF-beta1 in the highest amount. TGF-beta1 is a growth factor unique to umbilical cord blood that is produced in large quantities when a baby grows from an embryo. It not only supports collagen production, cell proliferation, and differentiation, but also suppresses inflammation and has the effect of suppressing cell proliferation. Furthermore, it contains many growth factors such as PDGF, which are said to act on cells and blood vessels and are involved in cell growth, which are essential for a baby to grow in the womb. This is also a major difference from stem cell cultures cultured from other tissues. Comparison with a stem cell culture solution derived from adipocytes. BioCell Shot 65 has 435 times more TGF-beta1 and 810 times more PGDF than other companies' adipocyte-derived cell culture fluids. In addition, 65% concentration of active ingredients such as FGF, KGF, and VEGF are formulated as a solvent while maintaining their effectiveness, so they are at the same level used in clinical research and laboratories, says Ryosuke Suzuki, MD, a skin regenerative medicine researcher. It is said that it is almost medicinal level, not cosmetic. It contains about 300 types of growth factors such as growth factors, cytokines, interleukins, SOD, and exosomes. Fat cells-derived products are characterized by a high content of EGF. EGF is an excellent growth factor, but excessive intake may cause cancer and cause age spots due to its ability to create capillaries. In contrast, cord blood has a high proportion of TGF-beta1, promotes collagen production, cell proliferation, and differentiation, and also contains a large amount of PDGF, which acts on cells and blood vessels and is involved in cell growth. BioCell Shot has a high growth factor content of 65%, which can be said to be at a pharmaceutical level that exceeds that of cosmetics. Regarding the activity value, stem cells are stored frozen and thawed before use, and then used for injection or infusion, but the activity value is similar to the freshness of newly collected state. The raw materials used in BioCell Shot 65 have a high activity value of 78% and have excellent functionality. It can be said to be a versatile anti-aging product that is both safe and functional. Many stem cell cosmetics use only stem cell culture fluid, but in the field of skin regenerative medicine, it is considered effective to mix cell growth factors with biomaterials such as hyaluronic acid and collagen to enhance functionality. We will introduce it into the dermis together with BioCell Shot 65 and Serum Cures Potel, which contains biomaterials collagen and elastin. The collagen in Serum Cure Potel has a triple helical structure, and by trapping hyaluronic acid and growth factors in the gaps between them and releasing them slowly, it is possible to make them function properly. The clinical evaluation introduced in the paper also used BB Pinocchio DM5 Super DX Plus along with BioCell Shot 65 and Serum Cure Potel. Iontophoresis has been the mainstream beauty method commonly used in the medical and beauty industries, but we focused on the introduction method called electroporation, which had been used in European medical care for about 30 years, and saw the potential for beauty industries. We conducted clinical trials from 3 perspectives: security, safety, and results, and were able to commercialize this product for the first time in Japan. Approximately 20 years after research and development, we have developed the cytoplasm path system through joint research with Dr. Haru Suzuki of Suzuki Plastic Surgery Pediatrics in Kyoto and Professor Toyoho Ueda of the Department of Science and Engineering, Meisei University. In order to confirm not only the clinical effectiveness but also the safety, we have conducted over 50,000 cases at affiliated medical institutions and salons that have introduced the product. We are currently conducting research and development together with affiliated medical institutions and expert teams. We upgraded it to medical specifications based on feedback from the medical field and developed the BB Pinocchio DM5 Super DX Plus after conducting safety trials. BB Pinocchio DM5's trajectory. 2005 started research on DDS drug delivery system and electroporation method. 2006 developed cytoplasm path system. 2006 launched Japan's first electroporation device, BB Pinocchio DM5. Research results presented at academic conferences both domestically and internationally. Japanese Dermatological Association, DDS Society, etc. 2008 released BB Pinocchio DM5 Super DX, and established as an innovative advanced introduction method created with doctors using cutting-edge technology. 2018 improved and upgraded based on feedback from the medical field, and a medical specification was developed for use by doctors. After undergoing safety trials, BB Pinocchio DM5 Super DX Plus was released for professional salon use. As a result of research, it has been confirmed that the cytoplasmic path system, which introduces polymers and non-ionized neutral molecules into the dermis without using an injection needle, changes the introduction efficiency by changing the frequency. It has also been confirmed that by changing the waveform, there is an electrical effect such as lifting and muscle movement, and that the introduction rate changes depending on the number of poles and diameter of the attachment. All functions included in BB Pinocchio DM5 Super DX Plus have evidence. We have presented the evidence resulting from such research at academic conferences both domestically and internationally. BioCell Shot 65 is effective just simply applying it onto the skin, but in order to maximize its effect, it is installed in the BB Pinocchio DM5 Super DX Plus, which has electroporation functionality. The cytoplasm path system makes it possible to deliver biomaterials such as hyaluronic acid, collagen, and elastin to the dermis in their polymeric state, which cannot be done by just simply applying them onto the skin.
Cytoplasmic pass system.
This is evidence of verification of subcutaneous residence time of low molecular hyaluronic acid with a molecular weight of 6,000 and high molecular hyaluronic acid with a molecular weight of 1 million, after introduction.
In this graph, the vertical axis represents the amount introduced, and the horizontal axis represents subcutaneous residence time.
The red line represents low molecular weight hyaluronic acid with a molecular weight of 6,000, and the green line represents high molecular weight hyaluronic acid with a molecular weight of 1 million. Immediately after introduction, approximately twice as much low molecular weight hyaluronic acid was confirmed under the skin, but within 24 hours it disappeared. On the other hand, it has been confirmed that the high molecular hyaluronic acid disappears after 72 hours, that is, after 3 days. After the introduced hyaluronic acid diffuses and disappears under the skin, the low molecular weight hyaluronic acid is broken down by the activity of an enzyme called hyaluronidase. On the other hand, high molecular hyaluronic acid cannot be completely broken down by enzymes and disappears over 2 to 3 days through phagocytosis by immune cells called macrophages. Humans poop when they eat something, and similarly, cells also poop when they eat something. What corresponds to that poop is a growth factor. This phenomenon is the same as the mechanism of wound healing. Macrophages work, cell regeneration is turned on, and growth factors are secreted through phagocytosis. By introducing a large amount of this, it is possible to accelerate regeneration.
This is truly the realization of skin regenerative medicine. What is the mechanism for healing wounds?
Stimulation from the injured area causes macrophages and fibers to proliferate cells. Fibrous cells produce vascular endothelial growth factors to promote new blood vessels, and vascular endothelial cells produce growth factors to promote collagen production. Possibilities of electroporation and the cytoplasmic pathway system from the perspective of wound healing.
In the process of wound healing mechanism, electroporation is considered to be very effective in collagen production.
Collagen can be created by introducing polymeric hyaluronic acid into the dermis using an electroporation device, which tricks the cells into thinking that they have been damaged. Understanding the mechanism will expand the possibilities for beauty applications.
Skin wound healing mechanism. Nothing happens without injury or stimulation. Here, we will explain what regenerative medicine using wound healing mechanisms work. The skin that covers the entire human body is the largest connected organ in the human body, accounting for approximately 16% of the body weight including subcutaneous tissue. The area for adults is approximately 1.6 square meters, and the entire area is in direct contact with the outside world. 1.
Protection from ultraviolet rays, physical, chemical stimuli, and germs.
Just imagine what would happen if you exposed your heart to UV rays or shampooed it. It will probably stop working. But what about the skin?
It has a protective function and retains living organisms.
2.
Maintains body temperature to regulate body temperature.
3. Retains moisture to prevent water loss and permeation. 4.
Functions to regulate body temperature through absorption and sweat.
5. Functions as a sensory organ.
The average thickness of the epidermis is approximately 0.2 millimeters, and 95% of the cells that make up the epidermis are keratinocytes. These keratinocytes has cell division in the lowest layer of the epidermis and migrate to the upper layers as they mature. In the epidermis, keratinocytes with different shapes depending on the stage of maturation are arranged in layers, and are classified into 4 layers from the deep end: the basal layer, the spinous cell layer, the granular layer, and the stratum corneum. The time it takes for basal cells to divide and fall off the epidermal surface is called turnover, and is said to take approximately 1 month. If the wound reaches the dermis, it will bleed. monocytes, neutrophils, lymphocytes, red blood cells, etc. will flow out, platelets will aggregate, and a fibrin network will form to make scabs to stop the bleeding. Blood vessels rupture, platelets aggregate, and fibrin networks are formed, and growth factors deliver the messages required for this process.
Growth factors move while forming the inside of blood vessels. 1.
Angiogenesis begins due to stimulation from the wound, but it cannot regenerate without nutrients, so blood vessels are created from blood vessels deep inside.
The blood vessels are then wrapped in collagen and solidified. 2. Division and proliferation of vascular endothelial cells.
3. Development of vascular buds and fiber cells produce vascular endothelial growth factor and promote angiogenesis.
4.
Formation of vascular loops. The fibers of vascular endothelial cells produce cell growth factors, which cause cells to proliferate and promote collagen production.
5. Vascular loop. 6. Formation of new vascular network. Apoptosis.
This is a command to kill blood vessels that are no longer in use or that are overproduced.
Collagen is what makes blood vessels.
Fibrous materials such as collagen type I and type 3 are bundled together to form a rope-like shape. Depending on the stage after the wound is formed.
1. Vascular response. 2. Blood coagulation. 3. Inflammatory reaction. 4. Granulation tissue. 5. Epidermal formation. 6.
In the process of wound contraction and wound healing, a series of these phenomena proceed in a coordinated manner, and necessary growth factors work in this process.
Skin wound healing can be broadly divided into the inflammatory stage, granulation tissue formation, and tissue remodeling stage.
They progress overlapping each other, but there are important cells at each stage. During the inflammatory stage, the cells are platelets, neutrophils, and macrophages. During granulation tissue formation, the cells are fibrous cells, macrophages, vascular endothelial cells, and keratinocytes. During tissue remodeling, the fibrous cells are vascular endothelial cells, smooth muscle cells, and keratinocytes. The functions of these cells are intricately regulated by released cytokines.
Cytokines and cell growth factors.
Cytokines are chemical substances, proteins that act as bridges between cells, and they are sometimes referred to as synonyms for cell growth factors, but the circumstances in which they were discovered are different.
Cytokines are biological defenses in the process of immune and inflammatory reactions.
Growth factors are regulated for proliferation and differentiation.
Difference from hormones.
Hormones act over a wide range of organs, but growth factors act locally and within a relatively narrow range. Growth factors have many similar molecules and form families. In summary, PDGF, TGF-beta, ILS, and FGF are mainly involved in the inflammatory process, which stimulates the migration of inflammatory cells and mesenchymal cells. In granulation tissue formation, PDGF, VEGF, FGF, and HGF promote angiogenesis. PDGF, TGF-beta, and IGF-1 stimulate fibrosis, and TGF-beta, KGF, and EGF mainly stimulate reepidermalization. In scar tissue remodeling, TGF-beta and IFN reduce blood vessels in cells, while TGF-beta, PDGF, EGF, and FGF rebuild the extracellular matrix. In this way, many growth factors act in a complex manner on various cells to promote wound healing. Cultured dermis has been shown to release many of these growth factors that are important in the progression of wound healing.
Research on EGF is also currently underway with the aim of clinical application.
In conducting these studies, we believe that it is necessary to fully understand the role of growth factors in wound healing.
Applied in beauty.
When PDGF and TGF-beta, which do not exist in a normal state, enter the dermis, it causes the cells to misunderstand that a wound has occurred, and collagen is created through the wound healing mechanism, leading to anti-aging properties such as firmness and elasticity. There are cells called fibroblasts that produce ingredients essential for skin firmness and elasticity, such as collagen, elastin, and hyaluronic acid. By turning on the cell production switch and accelerating the production of new cells, it leads to the improvement of all kinds of problems such as wrinkles, sagging, dullness, spots, and skin problems. Treatment using BioCell 65 can achieve regenerative medicine-level treatment using the wound healing mechanism, but without using injection needles and skin damage.
Regenerative medicine hair concerns in modern society. Hair growth program based on regenerative medicine using umbilical cord blood-derived stem cell culture fluid.
Concerns about the scalp and hair, decreased volume, increased hair loss, sparse hair roots, lack of firmness, concerns about the hairline and parting, thin hair. Points necessary for hair growth for women who are worried about thinning hair and hair loss.
Point 1. Unraveling the cause of thinning hair. Point 2. Direct delivery to hair matrix cells. Point 3. Promoting blood circulation through drainage. The role of active ingredients for unresolved thinning hair. Hair growth, the power to create the origin, to make hair grow. Hair growth, power to grow, maintain, and grow hair. It is effective when properly introduced with the cytoplasm pass system. We conduct various clinical trials to improve customer satisfaction and propose programs that solve modern hair problems for both women and men. Mechanism of hair growth using growth factors. Dermal papilla cells produce many growth factors such as FGF7, VEGF, and IGF-1, which have a strong influence on the division and differentiation of hair matrix cells, and use nutrients and oxygen as energy to create hair. KGF of FGF7, keratinocyte growth factor, is thought to act directly on hair matrix cells and promote hair growth, and the gene expression level of FGF7 is higher in dermal papilla cells derived from thinning hair areas than in healthy hair areas. There are also reports that it has decreased by about half. As a vascular endothelial cell growth factor, VEGF promotes the development of a capillary network around hair follicles and supports cell division by supplying nutrients to hair matrix cells. IGF-1 suppresses the transition to the catagen and telogen phases of the hair cycle through its anti-apoptosis effect. Hair is produced by hair growth signals caused by growth factors, promoting hair growth and hair growth. This is an in-hospital case at Suzuki Plastic Surgery Pediatrics Department where BioCell 65 was introduced into the scalp. In addition to anti-aging care using BioCell shot facials, we also offer programs for hair growth by introducing it into the scalp. Good news for those who suffer from acne. Proposals for acne care that cannot be treated with traditional treatment. It is also expected to be used to solve acne that are as difficult to treat. Acne changes depending on the stage. The approach changes at each stage, but basically it is important to treat acne early, prevent acne recurrence, and suppress the formation of acne scars. However, when acne bacteria breed in white or blackheads, they begin to become inflamed and turn into red or yellow acne. Many people administer steroids to suppress this inflammation, or use excessive amounts of disinfectants to kill acne bacteria. In this case, steroids will delay turnover and the disinfectant will cause a decline in the original skin barrier function. Furthermore, here is a risk of worsening the symptoms and leaving acne scars. Of course, it is important to disinfect acne bacteria at the stage of red acne and yellow acne, but we also believe that it is important to promote the natural biological ability to remove bacteria, turnover, and wound healing. The growth factors contained in BioCell Shot calm down excessive inflammation caused by bacteria, promote turnover, and promote the removal of foreign sebum. For those who suffer from acne, I highly recommend using BioCell Shot, which enhances your own healing ability. BioCell Shot under 35. Approximately 4 years have passed since the release of BioCell Shot 65, and since its release, it has been established as a regenerative medicine treatment and has received high praise, with overwhelming effects on regenerative medicine, evidence building, and paper presentations at academic conferences. We have received a lot of feedback that it would be nice if it could be adopted as a menu item at a lower unit price at various salons. BioCell Shot 65 has been praised as an all-purpose anti-aging product that treats spots, wrinkles, and sagging utilizing regenerative medicine. However, we have received reviews that for younger customers in their 20s and under 35 would like to utilize the technology for constant use intended for prevention, rather than for regenerative purposes. To answer these voices, we have considered an introduction agent for younger consumers as part of the BioCell Shot series. As a result of discussions with our medical advisor Ryosuke Suzuki, MD, we found that a combination of 20% human umbilical cord blood cell acclimatized culture medium has the same hyaluronic acid and sedative effect as BioCell Shot 65. It has been released as BioCell Shot under 35, which additionally contains dipotassium glycyrrhizinate and EGF to promote turnover. According to Ryosuke Suzuki, MD, it is as effective against wrinkles, age spots, and pores as BioCell Shot 65, but it is supplemented by the addition of lacking growth factors EGF. In addition, it is expected to be effective against acne as it added dipotassium glycyrrhizinate into the umbilical cord blood-derived stem cell conditioned culture medium, which has a high soothing effect. It can be used by a wide range of people, including those who want to easily try BioCell Shot at home and those who suffer from acne. As concluded by Ryosuke Suzuki, MD, depending on the type of growth factor, the amount may be very small, but even at concentration of 20%, it has proven to be effective. Addition of EGF 0.001 μg/ml to promote turnover. Anti-inflammatory effects with dipotassium glycyrrhizinate. Additional content and prescription of hyaluronic acid. About treatment methods. Treatment procedure. After cleansing, apply BioCell Shot 65 to the entire face, then apply Serum Cures Potel over the entire face. Introduce into the dermis using the electroporation method researched and developed by our company, BB Pinocchio DM5 Super DX Plus, and perform treatments at the level of skin regeneration medicine. The treatment cycle. Basically, it is once every 2 weeks, but at the starting 2 weeks, once a week. Once the sustainability of the effect is confirmed, we recommend 6 sessions per course, with the remaining 4 sessions occurring once every 2 weeks. To turn on skin regeneration. It causes cells to misunderstand that they need to regenerate and repair the skin. From a skin histology perspective, the theory is that while the cells are doubting whether the switch was turned on the first time, by firmly turning it on again, skin regeneration can be accelerated.
for those who see noticeable results. If you see noticeable results after the first treatment, wait 2 weeks for the next treatment. The decision will be made based on your skin and customer feedback when you visit us for a follow-up visit after 1 week, but if you decide to have a treatment the next week after the treatment, then do not conduct BioCell 65 and instead, use regular cosmetic treatments and basic epidermal care. A course at the level of skin regeneration medicine that replaces PRP therapy. An anti-aging all-purpose course for people with all sorts of concerns and skin problems. Human umbilical cord blood cell condition culture fluid 65% BioCell 65. Highly functional collagen used in skin regeneration medicine Selim cures Potel. * Selim cures Potel is not available for those with acne-prone skin. Option: those who are concerned about age spots, whitening, and pores. Melanin reduction / collagen production promotion. Vitamin C derivative. Serum D cures VC. 3-tranexamic acid quasi-drug. Serum D cures TA. 1 course 6 times, once a week for first 2 weeks, once every 2 weeks. After the first course, continue the course with dermal care with BioCell shot under 35 and serum series, or once a month for maintenance. Combination of BioCell shot 65 and under 35. The basics are to start with 65% to 0% under 35. For those who tend to have skin troubles, try a patch test or start with 20% under 35. For young people, no need for strong wrinkle and sagging approaches, want to try it at a lower price range. For those who are concerned about introducing 65% continuation after completing the BioCell shot 65 course. Human umbilical cord blood cell condition culture medium 20% BioCell shot under 35. Highly functional collagen used in skin regenerative medicine. Selim cures Potel. * Selim cures Potel is not available for those with acne-prone skin. Option: those who are concerned about age spots, whitening, pores, and acne. Melanin reduction / collagen production promotion. Vitamin C derivative. Serum D cures VC. Tranexamic acid quasi-drug. Serum D cures TA. 1 course 6 times, once a week for first 2 weeks, once every 2 weeks. After 1 course young age group, stop dermal care for about 1 month, once a month for dermal care or maintenance with serum series. An approach to the dermis that can only be done with a needle. Dermal basic care course. Aging care, wrinkle / sagging improvement, skin quality improvement. Selim cures Potel high performance collagen used in skin regeneration medicine. Selim cures tense hyaluronic acid plus FGF fibroblast growth factor plus EGF. Recommended for maintenance and continuation after completing a regenerative medicine level course. Option: Deep Pro S, a fat dissolving agent for facial lines and double chins. Stain and melasma care course quasi-drug tranexamic acid Selim D cures TA aging care, stain and melasma care. Stain / dullness improvement course vitamin C derivative Selim D cures VC aging care / stain / dullness / pore care / skin smoothness. Calming, moisturizing, whitening, finishing with cool white mask. Dermal special care course. Improving all your worries and troubles. Selim cures Potel high performance collagen used in skin regeneration medicine. Selim cures tense hyaluronic acid plus FGF fibroblast growth factor plus EGF. Selim D cures TA quasi-drug tranexamic acid. Selim D cures VC melanin reduction, collagen production promotion antioxidant vitamin C derivative. Recommended for maintenance and continuation after completing a regenerative medicine level course. Option: Deep Pro S, a fat dissolving agent for facial lines and double chins. Calming, moisturizing, whitening, finishing with cool white mask. Collection of clinical data from Suzuki Plastic Surgery and Pediatrics, including tools useful for counseling and sales promotion. BioCell shot 65 for 20 subjects. BioCell shot under 35 for 17 subjects. Clinical data on hair growth. BioCell shot 65 for 12 subjects. We are currently conducting clinical trials and will add new items every year. A booklet of papers submitted to Fragrance Journal and papers presented at the 40th annual meeting of the Japanese Society for Investigative Dermatology. Certificate from the International Medical Association in Dubai. These can be used for counseling tools at salon. We also have sales talk manuals, functionality explanation videos, PR videos, and leaflets for agents.